Hello, my name is Dr. Keith Crawford, and I'm the Director of Clinical Trials and Patient Education at Prostate Health Education Network. Today, I'm here with Dr. Cora Sternberg. She is the Clinical Director of the Englander Institute for Precision Medicine at Weill Cornell Medicine, and Mike Crosby, who is a United States Navy veteran, a prostate cancer survivor, and founder and CEO of Veterans Prostate Cancer Awareness. Hello, everybody.
Hello, glad to be here.
Today, we'll discuss how patients diagnosed with prostate cancer navigate biomarker testing and the role healthcare providers have in helping guide their patients through that process. We will also discuss how these test results can be used by patients and their care providers as part of shared decision-making about potential treatment options. Mike, perhaps you could start by telling us about your prostate cancer journey, such as when you were initially diagnosed with prostate cancer and what tests your healthcare provider ran during your journey.
Sure, Dr. Crawford. I'm Mike Crosby. I'm 63 years old, and today I live in San Diego, California with my wife. I served 25 years in the U.S. Navy and retired in 2009. But I was first diagnosed with prostate cancer in November of 2015 at the Phoenix VA. And during my service, I was lucky that I had been used to doing annual flight physicals as a requirement. And since then, I do annual exams, and I keep inquiring about my PSA levels, just having understood what the importance is. And initially, we just monitored the PSA scores over time. But then I had a high PSA level of 14.7 in 2015. And the next day, I had asked for a biopsy, or we had talked about a biopsy. So I stepped out into the community and had a biopsy, and that's where I learned I had prostate cancer. My doctors outlined several approaches that we could take, including radical or robotic prostatectomy or radiation treatments. I chose radiation, and after my initial SBRT treatment, my PSA levels, they decreased as predicted. Unfortunately, since then, I've had 2 subsequent recurrences of prostate cancer, and the most recent occurred during the COVID-19 pandemic. After my first disease recurrence, my care team conducted the biomarker testing on my blood for the germline or inherited genetic alterations, and on a tumor biopsy that had been obtained previously for genetic alterations that were only found in my tumor. Through these tests, it was confirmed that I have an inherited germline BRCA or BRCA2 alteration.
Mike, how did you handle the prostate cancer diagnosis initially?
When I was first diagnosed, I really had no serious signs or symptoms. As we look back on it, I had a urinary urgency that I was dealing with, but I just thought it was, it was something that you had when you got older. But like most men, I felt terrified when I first learned of prostate cancer. I was worried about, what my life was going to turn out like, what were we going to be doing living with cancer. But luckily, now I work with a great team, a care team that makes me feel supported throughout the entirety of my journey.
It seems like you really advocated for yourself throughout your journey. Tell us more about that.
Well, before my diagnosis, I knew absolutely nothing about biomarker testing. It didn't exist, or in my mind, it didn't exist. But since then, I've learned so much about it that it can mean and what it can mean for a patient and also for their family. It wasn't until the progression of my cancer in 2018 that the biomarker testing was even mentioned or offered to me. So I'm glad I got tested, and I met with a genetic counselor who taught me and my family about what those results might mean or what they do mean. And the genetic counselor was able to explain what alterations to be aware of and what impact they could have on me and my health.
So, in your opinion, how important was learning about your biomarker status? And what influence did this have on your prostate cancer journey?
Well, I'm very blessed and lucky in that I learned a lot about biomarker testing and genetic identifications through a strong care team in Los Angeles. And I encourage anyone who has prostate cancer diagnosis at any stage, regardless of what stage it is, to have a discussion with their care team about these biomarkers. And as we learn more about these disease states, it's more important than ever to understand how to get this test and what those results are. When I found out about my BRCA2 gene, I learned my 31-year-old daughter, Noelle, may be at an increased risk of developing certain types of cancer, such as breast and ovarian cancer. And she proactively sought testing after encouragement and an explanation of the benefits from the knowledge from myself and other family members. Biomarker testing will help her understand her genetic makeup and understand if there are any preventative procedures such as early screening and regular screening that she can do to lessen her risk of obtaining these certain cancers. But some people are not aware that there is a relationship between these gene alterations and cancer, and that these alterations can be inherited. So I'm doubly blessed to report today that she has been found to have no alterations that would increase her risk of any of the cancer types in question that we've mentioned.
So Mike, it sounds like being a proactive self-advocate made a real difference. Dr. Sternberg, do patients with prostate cancer typically receive information about biomarker testing?
Biomarker testing guidelines are discussed at most meetings that I have with my patients, but I must admit that I do work in an academic setting. This may differ to how often physicians in other practice settings discuss biomarker testing with their patients. Clinical guidelines recommend germline inherited biomarker testing in prostate cancer patients with metastatic disease, regional disease that is node positive, high-risk localized disease, and in patients of Ashkenazi Jewish ancestry, and also in patients with a family history of certain BRCA-related cancers. Yet, real-world studies found that physicians only ran tests for germline or somatic tumor alterations in some 26 to 28% of patients with metastatic prostate cancer. There are plenty of biomarker testing options available to healthcare providers. The problem partially comes down to a lack of information and awareness about when to offer the biomarker testing.
How can this gap in awareness around biomarker testing and prostate cancer be filled? Dr. Sternberg, perhaps you can answer the question first from the perspective of the healthcare provider.
I always recommend that healthcare providers become more familiar with the guidelines available for biomarker testing. Clinical guidelines provide information on when to carry out germline testing, which test DNA inherited from a patient's parents using a blood sample or saliva sample versus somatic testing, which tests the DNA in the tumor itself. Physicians should speak with their patients to better understand their history and that of their families so that they can identify patients who are eligible for germline testing. Importantly, and in addition to prostate cancer, germline testing can reveal a higher risk of hereditary cancers such as breast and ovarian cancer syndrome in patients who have BRCA1 and BRCA2 mutations, and Lynch syndrome, which is associated with alterations in mismatch repair genes and is an inherited genetic condition that increases a person's risk of developing several cancers, including colon, breast, prostate, and endometrial cancer. Guidelines recommend somatic testing for patients with metastatic prostate cancer and indicate that testing should be considered for patients with regional prostate cancer as well. Whether germline or somatic testing is undertaken, there are broad gene panel tests available.
Mike, based upon your own experience as a patient who has undergone biomarker testing, what can we do to raise awareness and facilitate understanding of biomarker testing for prostate cancer?
Great question, Dr. Crawford. It's important to know how certain genetic alterations might impact your risk or treatment experience and options for treatment nowadays. Patients also do not necessarily know that some genetic alterations can be hereditary, so conversations should take place in families where there are known instances of cancer diagnosis. And I suggest that we can take advantage of the fact that some genes like BRCA2 are recognizable in the public now, and use those to educate people on what gene alterations are and which ones affect prostate cancer risk. Since BRCA2 gene is commonly associated with breast cancer in our population, many people do not realize it can also relate to other hereditary cancers.
And Mike, what was your first reaction when biomarker testing was brought up by your healthcare provider?
Well, at the beginning, I wasn't familiar with it, but soon was educated and understood that there was a lot to learn about biomarker testing in which genetic mutations matter. And taking responsibility of your own health and understanding the impact your condition can have on not only your health but your family is simply part of that responsibility.
Dr. Sternberg, in your clinical practice, what are the common barriers and causes for patient hesitation to biomarker testing?
To be honest, I work in an academic medical center where many of my patients undergo both germline and somatic testing when it's explained to them clearly. But I can imagine that patients might ask about cost. They may have children or siblings that they're concerned about. A prostate cancer diagnosis can be deeply personal, and so patients are invested in the security of their information. Additionally, patients are often concerned about how their information might be used. Like, they might worry about the stability of their jobs if they're found to have a genetic alteration. Title II of Genetic Information Non-Discrimination Act prohibits employers from using a person's genetic information in making employment decisions such as hiring, firing, job assignments, or any other terms of employment. It also prohibits employers from requesting, requiring, or purchasing genetic information about a person or their family members. They may need time to digest the information that I have provided. I'm talking about my patients now, and I tell them that they can think about it and they can come back at another time to discuss this again. It usually needs to be discussed more than one time with patients before they really understand and can digest all of the information.
So thanks for the great insight, Dr. Sternberg. So, given these barriers, what advice do you have for how healthcare providers might best present the topic of biomarker testing to their patients?
I think that Mike and I are very aligned on this point. And as we have already mentioned, I would explain the benefits of testing, how the results of testing can help inform patients about the potential outcome of their prostate cancer. Testing can provide new treatment options so we can engage in shared decision making, and how we can use the results of biomarker testing also to support a patient's family and understand their risk of developing certain cancers in the case that a hereditary gene alteration is found. I would also assure my patients that their test results and what they mean will be explained to them through discussions, very often with a genetic counselor when it's available. Most community practices don't have a genetic counselor on staff. Appointments with genetic counselors may often be arranged.
Mike, what biomarker test did your healthcare provider order for you? And do you know what type of sample was used for your biomarker test?
I do. My oncologist has educated me on this, and he ordered a blood test and provided also the tissues from my biopsy to better learn about my disease and the genetic background of that disease.
And thank you for sharing that information with us, Mike. Now, do you think patients have a preference over the type of samples used for biomarker testing? For example, tumor tissue, blood, saliva?
Well, I don't think a lot of patients have a preference because they still don't know enough about the differences between the genetic and somatic testing. And without an in-depth understanding, they really can't determine if tissue, saliva, blood samples, or any of those are really preferred or which ones they should provide.
Who ordered your biomarker testing, Mike? And who was responsible for monitoring the process?
At the time, my medical oncologist ordered the biomarker testing. And he also, because of the lack of genetic counselors, he discussed that option with me and what the results could show or should show. And then they also scheduled a genetic counselor who reviewed the results with me and my wife together. The genetic counselor has helped us and has stayed in touch with us to understand the results of those things and made herself available to us if there were any questions. So it's a great service.
Okay. Dr. Sternberg, is there anything that you would like to add from a healthcare provider's perspective about ordering of biomarker testing and monitoring of this process?
Based on my clinical experience practicing in the U.S., I've not experienced major issues when accessing biomarker testing for my patients. However, this is based on experience in an academic setting, which may differ to my colleagues based in the community setting.
It must be an anxious time for patients as they wait for the results of their biomarker testing. Dr. Sternberg, how long do patients typically wait for their results?
In general, results for biomarker testing using a blood sample can take more or less 2 weeks to come through, where results from tumor samples may take anywhere from 2 weeks to up to a month, depending on where you work, for example, in an academic institution or in a private practice.
So Mike, in your experience, how long did you have to wait for your biomarker test results?
Yeah, Dr. Crawford, it was actually fairly efficient. It took 2 weeks to receive the results, and then it was immediately followed with the counseling session from the genetic counselor.
So Mike, also, what information were you given about your biomarker test results? And were the results easy to understand? And one other point, in your opinion, what would help make these results more easily digestible for patients?
My report showed what gene alterations that I do have. I didn't understand the results at all on my own when I was first given this 8-page document. The panel that was done and the results provide so much information, it can really feel overwhelming.
Right.
I was lucky that I have a great care team. My oncologist provided a lot of education about the biomarker testing. I mean, they do it every day. And before the testing, and explained my testing results to me when that document was available. And when available, the genetic counselors, I think they play a critical role in ensuring that a patient understands the results and the impact on himself, on that patient, and also on the family members. And it's vital to debrief these results, I think, with a genetic counselor who can break down the findings in more digestible ways to help you understand, but also help you communicate it to your family members as well.
Dr. Sternberg, is there anything that you'd like to add to this?
I think one of the key tools for personalized medicine is biomarker testing. A stronger understanding of genetic alterations in prostate cancer can help inform a patient's prognosis. At our institution, we're able to perform sophisticated, targeted panels on tumor tissue. And we even do whole genome sequencing in some more complicated cases.
And Dr. Sternberg, do you have any examples of how a patient has asked you about biomarker testing? And is there any advice you can offer to encourage the discussion between the patients and the healthcare provider about this topic?
Most patients want to better understand what it means if they have a genetic mutation for themselves and also the implications for their families. It's never too early to begin asking your healthcare provider about biomarker testing. As Mike mentioned, become an advocate for yourself and bring as much personal and family medical information as you can to your appointments with your healthcare provider, specifically if it relates to past and family cancer diagnoses.
Mike, how did biomarker testing results impact treatment choices you made after discussions with your healthcare provider?
Well, Dr. Crawford, through my results, they didn't really impact me personally in my treatment journey, and they haven't so far. However, my results may impact my therapy options in the future if something was to reoccur.
As alluded to earlier, one difficulty that patients face is how to share the results of their biomarker testing with their family. Mike, could you share your experience of telling your family about your biomarker test results?
Dr. Crawford, everyone had the wind knocked out of them when learning about my genetic mutations and thought about the future effects it could have. However, everyone in the family is really happy that my daughter and I were tested and are sharing the knowledge and results throughout the entire family. And since my stepchildren actually have a family history of prostate cancer in the family, my daughter has now turned the tables and encouraged them to go through with the testing and to do it sooner rather than later so that they can understand what their potential risk could be. And while some people opt not to learn about their genetic background, I truly understand the value of the knowledge and have really gained a lot from all of the information that's been provided.
Now, Dr. Sternberg, as we discussed earlier, biomarker testing can feel quite personal to patients. How do you guide your patients through the decision of whether to share this diagnosis with their family and encourage them to undergo testing should an inherited gene alteration be found?
Well, ultimately, it's up to the patient whether to share the results with their family. Just as a patient finding out that their prostate cancer contains a genetic alteration with predictive and prognostic factors can be difficult, sharing that news with their family, especially anyone who may have an inherited gene alteration, is certainly difficult. During the follow-up visit after biomarker testing, a multidisciplinary team is often involved if possible. I would have a candid discussion with the patient about what their results mean and how it will impact upon their treatment journey. And I often have this discussion more than one time so that they understand clearly what we're talking about. Based on the results, I think it's important for patients to understand the difference between which gene alterations are heritable and which are not, and be aware that they have no control over which genetic alterations they inherit and pass on. It may be important to speak with a professional who can educate an individual based on their testing results.
Mike, what questions did your family have about your BRCA2 alteration?
Dr. Crawford, I have two stepsons and a stepdaughter, and while they did not need to immediately undergo the testing after hearing about my results, because they cannot directly have an inherited BRCA2 gene from me or from my line, but they were encouraged to be more diligent about their own family history and the fact that they do have a prostate cancer history in their family to go about their routine prostate cancer screenings, and also from my daughter's standpoint, breast cancer and ovarian cancer type screenings. They also know that the benefit of biomarker testing and how it could affect both their own treatment options as well as the effects on now my grandchildren. Now my daughter is fortunate to have the insight from my tests. Otherwise, she might never have proactively participated in testing herself. And we're really grateful today to share the results of her testing were negative, and she has no mutations that will affect her health in those specific areas of those that can be affected by those mutations.
Finally, what advice would you both provide to a patient who has not been offered biomarker testing by their healthcare provider?
Ask your doctor about biomarker testing or seek advice from a genetic counselor. They're hard to get to, but you can find them if you want to be more informed. It's so important for men and their families, men who have prostate cancer and their families, to have a stronger awareness of what this biomarker testing can mean and the importance of routine screenings. And patients should always advocate for themselves and take advantage of opportunities such as testing to gain greater knowledge of their general health and of any specific disease types.
I agree with Mike. It's never too late to ask your healthcare provider about biomarker testing. If you have high risk or advanced prostate cancer or a family history that might indicate you're at risk, it's essential that you become proactive and that you talk to your doctor.
That concludes our episode for today, discussing how patients diagnosed with prostate cancer navigate biomarker testing in their journey. Now, thank you, Mike, for sharing your personal experience with prostate cancer with us.
You're welcome.
And thank you, Dr. Sternberg, for sharing your knowledge and expertise on how both healthcare providers and patients can more effectively communicate about the options that are available to them. Now also, please, I'd like you to tune in to our previous episodes where Dr. Sternberg and Dr. Hafner, a genital urinary pathologist, both of them discuss the importance of biomarker testing for patients with prostate cancer and debunk common misperceptions and barriers surrounding biomarker testing. Thank you.